Chelated minerals do not need ionization and are not pH dependent, which result in an improved absorption and higher bioavailability. The magnesium bisglycinate combination enables efficient absorption. The glycinate allowing the magnesium to transfer easily across the intestinal wall. Increased absorption means more usual magnesium bodies needs. We call this it absorbed through intracellular spaces in the intestine. Intracellular. Better safety and tolerability. In a study which compared magnesium oxide and magnesium glycinate chelate in the ileal resected patient, the magnesium glycinate caused fewer bowel movement and did not produce diarrhea. Another study conducted in healthy adults reported that magnesium glycinate chelate at doses of 450 milligram and 600 milligram magnesium per day had good bowel physiological response as determined by fecal consistency score. We have to use extensive in the clinical study. Normally, we require 320 milligram to 420 milligram per day. But this is a study, we have used 450 milligram to 600 milligram per day, even though we could not find any complications with the patients. It is so being tolerated by the patient. No gastrointestinal complications by this bisglycinate. The role of magnesium in diabetes. How we can and why we should use it. Magnesium supplementation has been suggested as a possible non-pharmacologic, economic, safe treatment for prevention and metabolic control of diabetes too. One randomized, double-blind, placebo-controlled study in 63 individuals with the type 2 diabetes mellitus and hypomagnesemia found that those taking an oral magnesium supplement, that is 638 milligram per day of elemental magnesium for 16 weeks, had improved measure of insulin sensitivity and glycemic control compared to those taking a placebo. Another study which explained a recent meta-analysis of 9 randomized double-blind controlled trial concluded that oral supplement magnesium lowered fasting plasma glucose concentration in individuals with the diabetes. The another meta-analysis of trial that included participants at the risk of diabetic mellitus or with the diabetic mellitus suggested that evidence to support the benefit of the magnesium supplementation on measure of insulin resistance was stronger in subjects who were magnesium deficient than in those with the normal serum concentration of magnesium. According to recent guidelines of Association for Magnesium Research, patients with a diabetic benefit from 4 effects of magnesium supplementation. These are the advantages. If my diabetic patient will use the magnesium, number 1, it will sensitize the insulin receptors. Number 2, it is a calcium antagonist. Number 3, stress regulating. It will regulate your stress. And most important, endothelium stabilizing effects. So these are the 4 important characters by using the magnesium. It will sensitize my insulin receptors. So the resistance will not come. Patient can use the therapy for a long time. It has been seen with the anti-diabetic drug after some time, the patient is not responding to the existing anti-diabetic drug because receptors become resistant. Number 2, the calcium antagonism is required. So we can maintain the concentration of the insulin in the blood. And third, the stress is one of the most important cause of the diabetes. So patient can become stressless by taking the magnesium. And endothelium stabilizing effect. It's a well proven. So complications will not be there in the cardiac region. They are very common when the diabetic patient is there. There are all the possibilities he can suffer with the cardiac complications. So by taking the magnesium, not only it will take the diabetic, it will take care of his heart also. In diabetes, the Association of Magnesium Research recommend daily magnesium supplementation between 420 to 480 milligram, that is 10 to 20 millimole per liter. Normally, we require more than 0.75 millimole per liter. By taking the magnesium by 240 milligram to 480 milligram, we are going to maintain 10 to 20 mole per liter. So definitely the patient will respond well in diabetes by taking the magnesium. Now, the role of magnesium in osteopenia and osteoporosis. It's a very common complication. One is related to age and related to the drugs also. We call it the drug induced. So dietary magnesium deficiency has been hypothesized as a potential risk factor for osteoporosis. Epidemiology studies have shown that elevated dietary intake of magnesium were positively and significantly related to bone mineral density. On the opposite, inadequate dietary magnesium intake were linked to an increased rate of bone loss in post-menopausal osteoporotic women. In addition, magnesium is necessary for vitamin D synthesis, transport, and activation. Hence, magnesium deficiency would impair the production of active form of vitamin D, that is 125 hydroxyvitamin D3, which is an active form of vitamin D3, and cause resistance to parathyroid and vitamin D action. As the magnesium content of bone decreases, hydroxyapatite crystal of the bone may become larger, leading to more brittle bones. Some studies have found lower magnesium content and larger hydroxyapatite crystal in the bone of women with osteoporosis compared to the disease-free women. In women, the Health Initiative study, the wonderful data we have received, the data analysis from 4,778 participants, the mean age was 63 years because the menopause start after 50 years. So that is the age group was taken 63, where the osteoporosis is very common. Followed for about 7 years, showed that higher magnesium intake were associated with higher hip and whole body bone mineral density. Moreover, the highest versus lowest quintile of total magnesium intake was associated with 23% increased risk of lower arm and wrist fracture. Another important study, a recent randomized control study conducted in 20 post-menopausal women in osteoporosis, suggested that high dose of magnesium supplementation for 1 month could reduce the rapid rate of bone loss that characterizes osteoporosis. In participants to cohort osteoarthritic initiative followed for 8 years, it was found that women with higher dietary magnesium intake had 27% reduced risk for future fractures, confirming the positive role of maintaining adequate magnesium balance in the risk of osteoporosis and fragility fractures. Role of magnesium in skeletal muscle disorder, which is very common in our routine practice. It has been observed. In my keynote, I have mentioned the skeletal muscle disorder is very common during the deficiency of magnesium. Magnesium ion has a key role in all enzymes utilizing or synthesizing muscles ATP, and thus in the production of muscles energy and directly in muscle contraction and relaxation. Magnesium deficiency has been related to a poor muscle performance. The magnesium deficiency has been suggested to cause muscles weakness, muscles pain, and night cramps. It has been proposed that magnesium deficiency may contribute to development of fibromyalgia. Another study suggested that magnesium supplement may be used to reduce muscle tenderness, pain, and symptoms severity in fibromyalgia subject. Important study In young volunteers, Birla et al. Showed that magnesium supplement up to 8 milligram per kilogram daily were able to enhance muscle strength and endurance performance and reduce the oxygen consumption. In older subject, Verenos et al. Showed that oral magnesium supplement 300 milligram per day were able to improve physical performance, particularly in those subjects the baseline of low magnesium dietary intake, proposing that magnesium supplementation may help in preventing or delaying the decline in physical performance with increasing gaze. Normally, the daily dose recommendation of magnesium is 4 to 6 milligram per kilogram body weight per day. But in most of the studies, if you see in general, it is 320 milligram to 420 milligram. In most of the clinical studies, the dose of the magnesium was taken 8 milligram, more than 4 to 6 milligram, or more to 320 to 420 milligram. Sometimes we have taken 600 milligram. Sometimes we have taken 700 milligram to see the tolerability profile of the magnesium. The most important complication in medical fraternity, they were not using the magnesium with this intention because they use the magnesium to remove the constipation. Milk of magnesium is very common and popular brand all over the world. Milk of magnesium. They use to remove the constipation. So that is why we have used extensive or upper limit of the magnesium to prove that when we use magnesium bisglycinate, probably you will not find such complications which you are getting with milk of magnesium, or you are getting with magnesium oxide or magnesium sulfate. So that is the advantage with the new technology, the magnesium. So can use for the extensive use. You can use up to the upper limit. Your therapeutic range is 4 to 6 milligram, but upper limit is 10 milligram per kilogram body weight. So most of the studies we conducted around 8 milligram per kilogram body weight, and we could not find any complication. It was well tolerated by my patient, apart from the result or efficacy of the drug was very much satisfied. The role of magnesium in hypertension is a very important indication. I think the cardiologist should use it because we are talking nutraceutical. And nutraceutical is very safe as compared to our drug and medicines. Very safe. A recent meta-analysis of randomized control studies with 2028 patients participants found that supplemental magnesium at a moderate dose of 368 milligram per day. Again, it was used not 320 milligram. We have used 368 milligram upper than our limit. That is range of 238 to 960 milligram per day for a median duration of 3 months, not for short duration. It's for 90 days. Range of 3 weeks to 6 months. Increase serum magnesium concentration by 0.05 millimole per liter and reduce systolic blood pressure by 2 millimeter mercury, and diastolic blood pressure was 1.78 millimeter mercury, which you can compare with any antihypertensive drug, maybe with the amlodipine. It's so safe, and you have reduced by taking one of the nutraceutical, that is a magnesium. A 2017 meta-analysis restricted the trial in participants with underlying preclinical insulin resistance or pre-diabetic or clinical condition type 2 diabetic mellitus